Okay, so this is the frontal belly of Epicranius, or you can also call it frontalis. Around the eyes are orbicularis oculi. Then these muscles coming off of the zygomatic bone are the zygomaticus muscles. Then over here, over the temporal bone, we have temporalis. We have the masseter for chewing. Then here you can see sternocleidomastoid. So it goes from the sternum and the clavicle, that's the sternocleido, to the mastoid, which is the mastoid process of the temporal bone for sternocleidomastoid. Then here is pectoralis major. And then this is superficial to the deep side over here. This is pectoralis minor. And then in between the ribs, we can see the intercostals. If the ribs are costa, then in between them is intercostal. So the striations that go hands to your pockets, as if you put your hands in your pockets, are external intercostals. And then they're deep to the external intercostals are internal intercostals. Then beneath pectoralis major, we see the external abdominal oblique. Again, the striations are like hands into your pockets. Then rectus abdominis is deep to that. And then the internal abdominal oblique is on the same level as rectus abdominis. And it's like hands to your throat is the internal striation. Then continuing just down into the legs, and we'll come back up into the arms. Sartorius. Sartorius is the longest muscle in the body, named after a sartor in Italian, is a tailor to like measure the inseam. So sartorius. Then in the quadriceps muscles, we have 4 muscles: vastus medialis, then vastus lateralis, rectus femoris, and if you take off rectus femoris, underneath that would be vastus intermedius. So a medialis, a lateralis, an intermedius, and rectus femoris make quadriceps femoris. Then with sartorius cut, we can see this adductor group. So add to the body's midline. The muscles that pull the leg towards the midline are the adductors, adductor. And within that here, what we can see is iliopsoas is this outer muscle, with pectineus being the next muscle. And then adductor longus is the muscle after that. And then adductor magnus after that, with gracilis on the inside, the most medial portion of the legs.
So is that your inner thigh muscle?
Mm-hmm.
Okay.
Yeah, so when people squat down, you'll usually see gracilis kind of pop out in a line that shows up on the inside of their thigh. Then on the lower leg, there's a mnemonic that we can use for this. It's called TEPSG. It's TEPSG, and the T is tibialis anterior, the E is extensor digitorum longus, the P is peroneus longus, or also called fibularis longus, the S is soleus, and the G is gastrocnemius. So starting from the anterior compartment, moving all the way around to the posterior is TEPSG. Then into the anterior portion of the arm, you have deltoid, biceps brachii, brachialis, triceps brachii, brachioradialis, extensor carpi radialis longus, and then the rest of our extensor group is in here. Our flexor group is anterior, And those are the major muscles that's everything you'll need to know in the arm. And then we can go posterior. Do you want a different video for posterior? Or,
Sure.
I don't know.